Good morning, everyone. Welcome. It's not great to see you all again. Actually, it is good to see you all again, and we really appreciate you coming here today. We had moved these to once a month. Unfortunately, as we're seeing a significant increase in cases and hospitalizations across the state, we felt it was important to bring everyone back together to talk about what's happening and where we go from here. I want to thank again our media partners who are here with us today, helping to spread the knowledge of this virus and what's happening in our state. We appreciate you over the past 18 months giving good and accurate information to everyone in our state. There are lots of sources of bad information, and we need those trusted sources to deliver the most accurate information. And throughout this pandemic, you have been those trusted sources. And so please accept our gratitude, and we appreciate you being here today. We also want to thank St. Mark's Hospital for hosting us today. The major reason that we brought you here together is to talk about what's happening in our hospitals. We hope that will be the top line story that comes out of this, so that people will understand what it is. And we'll talk more about that in just a second. We reported last month that our models were predicting upwards of 1,200 new COVID cases per day. Unfortunately, we are seeing those predictions become reality. On Monday, we reported 499 new cases of COVID-19, following daily reports of 790, 958, 1,215, and 1,112. This compares to 348 just a month ago. We're continuing to see not only an uptick in cases and case counts, but in hospitalizations. Now, what we know is that the Delta variant is highly contagious and it's spreading rapidly. As a result, our hospital ICUs are filling up and our healthcare workers are feeling the strain. We'll hear more about the impacts that hundreds of new cases are having on our hospitals across the state from Greg Bell, who is the president of the Hospital Association, in a moment. But I want to tell you this. So today, there are 367 people in the hospital with COVID. 1 month ago, there were 266 people in the hospital with COVID. Yesterday, we reported 15 more people had died of COVID. 7 of them were under age 65. 65 and under is far too young to die from something that is almost completely preventable. And you will notice that there is an uptick in deaths among younger people, unlike earlier in the virus when most of our deaths were over the age of 65. Now, there's a reason for that, and that is that we've done a great job of vaccinating people that are over the age of 65. And so they are being protected. It's the people under the age of 65 who have not got vaccinated at those same rates. We're basically 90% over the age of 65. So it's under that are not, and that's a problem, and that's why we're seeing deaths increase amongst that younger cohort. This is, as I've said many times, a pandemic of the unvaccinated. According to some of the CDC data that was leaked last week, unvaccinated people are 8.3 times more likely to be infected than vaccinated people. They are 25 times more likely to be hospitalized and 24 times more likely to die from COVID than unvaccinated people. We're also hearing more and more stories from families that decided not to get vaccinated and who are regretting that decision, who are suffering the effects of COVID. These stories are tragic, and we hope that in sharing them, and we appreciate the families who have decided to share those stories, that we can encourage more people to get vaccinated. So often when their family member is on a ventilator or a loved one gets extremely sick, by then they want the vaccine, but it's unfortunately too late. A couple of these that have been well publicized: a St. George police officer, Adam Ashworth, who caught COVID and after 2 weeks in the hospital tragically passed away. He was 39, the father of three. His wife said he didn't think he could get it, or if he did, it wouldn't be severe since he was in the prime of his life. And now his wife is telling everyone to please listen and get the vaccine. And we appreciate her courage. Mindy Green of Provo posted on Facebook about her husband Russ, age 42, and the father of four, who was fighting for his life in Utah Valley Hospital. She didn't believe COVID could be so deadly, so neither of them got the shot, but now she wishes that she and her husband had been vaccinated. These are the stories that we hear over and over again, and we plead with you to get vaccinated. There is some good news, and the good news is that we are seeing more people get vaccinated. Those numbers are starting to come up a little bit, not nearly enough. And I've thought a lot about what I could say to help people and encourage people to get vaccinated. And the truth is that there's probably not much. If they were listening to me, they would have gotten vaccinated anyway. And I understand that. Certainly, as we're having this type of press conference again and talking about this significant surge that we're seeing in cases and hospitalizations, there are lots of thoughts that go through our head. Lots of things I want to say, probably none of them which would be helpful. And so my plea to you is this. First of all, thousands of people got their first vaccine in the state of Utah last week. That means that there are thousands of people who recognize that they had made a mistake, and that it was important for them to get vaccinated. It's hard. Someone wiser than me said that one of the problems with people who believe conspiracy theories is it's not just enough to stop believing the conspiracy theory, but often it takes you away from your community, the people around you that believe the same way that you do. And I want you to know that that's not the case. That there are, again, thousands and thousands and thousands of people in our state who are getting the vaccine and will get the vaccine this week. And you can join them, and you can protect yourself, you can protect your family, you can protect your loved ones, and you can do this. We love you, we care about you. I promise I'm not part of some grand conspiracy theory. If you don't believe me, if you're if you're a religious person, if you're a Catholic, listen to the Pope, who said that this is a moral imperative for everyone to get vaccinated. If you're a Latter-day Saint, listen to the president of the Church of Jesus Christ of Latter-day Saints, who said that this is not just a godsend, but a literal godsend, literally sent from God to bless us. If politics is your religion, then believe Donald Trump, who was so instrumental in getting this vaccine to us, who got the vaccine himself, and who has encouraged others to get the vaccine. If you're a Democrat, you believe that the president elected from your party, President Biden, who has over and over again encouraged people to get the vaccine. If you're an atheist, there are lots of prominent atheists who are encouraging people to get this vaccine. It's one of those rare things that so many people can agree on, from different walks of life, from different races, from different religions, that this is here to save lives. We don't have to be going through this again right now if you will just please get the vaccine. Now, there will be consequences for those who decide not to get the vaccine. Those consequences may be hospitalization. Those consequences may be death. And while we've made a collective decision as a nation and a state, a decision which I support, the government will not force people to get the vaccine. That doesn't mean that we're free from our consequences, that others won't choose to require vaccines. Whether that is, those are group gatherings, other events, private employers, others who can require vaccines, who have the ability to do that. And so while I'm a person who believes in responsibility, I'm a person who believes in consequences. And if you choose not to get the vaccine, then those are the consequences that may happen. And we have to be willing willing to live with those consequences. And so again, just encourage everyone to please get the vaccine. Now, there's been a lot of talk about schools and what's going to happen with schools. And I so appreciate the hard work of our teachers and our school districts over the over the past year. Just the enormous efforts that were taken with parents and students and teachers and so many others to help us get through this this past school year. Our health department is incredible, and they've been working very closely. Now, as you know, there have been changes made in the law. The legislature decided last year that they wanted to take a more active role in managing the pandemic, and that is absolutely their right, and that's what they have done. And those decisions have been made. And so as the pandemic has changed, as our resources have changed, and as the law has changed, we now must operate under those new paradigms and where we are right now. And so parents, we've got kind of two categories, those 12 and over and those under the age of 12, right? Those 12 and over can get the vaccine. We encourage you to do so. Parents, you should know that if your child is not vaccinated, it is possible that they will get COVID this year. When the outbreaks start in schools again, there will very likely be disruptions to learning and extracurricular activities unless students are vaccinated. Vaccinated students won't have to quarantine. They won't have to miss practice, games, and competitions. Let me state that again. This is really good news. If your child is vaccinated and there are outbreaks that start in a school, your child will not have to quarantine. They won't have to miss practice, games, or competitions. Kids who are exposed to someone who tests positive for COVID-19 can continue to come to school if they are fully vaccinated, as I mentioned. If they and the person who tested positive were both wearing masks, if they have tested positive for COVID-19 in the last 90 days, or if they were wearing a high quality mask, an N95 or a KN95 mask, then your child will not have to be quarantined if they were wearing a high quality mask. So there's still time to get your kids 12 and up vaccinated before school starts, and we would strongly encourage you to do that, as school is scheduled to start in just a week or two in many of our school districts. Here's the other thing. So let me talk now about kids under the age of 12. Though there is some risk to children under the age of 12, and actually before I get there, interesting thing, you can't, no kids under 12 are vaccinated anywhere in the country, okay? But we are seeing greater spread in some states amongst kids than in other states. It may not surprise you to learn where those states are. Those are happening in states where there is a low vaccination rate, okay? Early in this pandemic, the reason we had to keep kids, the biggest reason to keep kids safe from this virus was to protect adults, because kids would spread it to adults, and the death rate was so much higher with adults. Now, the greatest way to protect kids is for adults to get vaccinated. Where we see a high rate of vaccination amongst adults, we see a very low rate of spread amongst young people. So the very best way to protect our kids is for adults to get vaccinated. So please, 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 adults, get vaccinated. Now, there are some COVID risks to kids under 12 and up. And we know that vaccines are currently being tested. We're hopeful that in the next couple months, we will see approval for vaccines in kids under the age of 12. The more likely scenario, though, is that an unvaccinated child will bring COVID home to an unvaccinated mom or dad whose risk is much higher. We know far too many stories like this. In fact, some of the stories I just shared with you are those stories. During last school year, we were fortunate to not have any large outbreaks at elementary schools. Most of our outbreaks were in middle school, junior highs, and high schools. We've known all along the COVID cases are generally more mild in young children. and vaccinated kids will generally prevent spread to other unvaccinated kids. The math on this is really simple. And I think it's important to share those numbers with you. When we're talking about our children under the age of 12, so ages 5 to 11, we've had, and this is data from last week. I haven't gotten the update yet, but we've had approximately 23,000 kids ages 5 to 11 who have tested positive for the coronavirus. Now, we know that number is much higher than 23,000, but those are the number that tested positive. Because it's so mild in kids, there were a lot of kids that just never got tested and likely had it. But 23,000 kids, 111 of them were hospitalized. Okay. That's a significant number. It's a serious number, but you can do the math on the percentages of those who tested positive versus those who were hospitalized. We had one death, ages 5 to 11, which is tragic, and especially tragic for that family and those friends. But those are the numbers. So now we get asked about masks and what we're going to do to mandate that. Obviously, right now, as has been well reported by everyone in this room, we do not have the authority to issue mask mandates, and schools don't have the authority to issue mask mandates. Local health departments do have the authority to issue mask mandates for school in conjunction with county elected officials. So they can do that for 30 days, and then the county council or the county commission would need to approve that going forward. So there is a possibility, if outbreaks occur, for local health departments in conjunction with their county officials at the local level to implement mask mandates. Now, I believe it's important. We have a solution to this virus provided by the government in the form of vaccinations for everyone who is 12 and older. We don't have anything for those under the age of 12. What we do know is that high quality masks are the next best thing that we have to a vaccination. So if you can't get a vaccination, we encourage everyone to wear a high quality KN95 or N95 mask. We don't know, as this Delta virus is so much more contagious, how well cloth masks work with the Delta variant. But we do know that KN95 and N95 masks work much better. And so I have instructed our teams to provide a KN95 mask for every child that wants one in the state. We are purchasing those now. We will make those available to schools so that that children and parents who want their child to be masked under the age of 11 will have, parents and students will have the opportunity to have available at no cost to them a KN95 mask. We encourage parents, if you have access to high quality masks, to get those for your kids. But we will make those available in every school in the state. We're working on getting those now. We will get them distributed as quickly as we possibly can so that we do have an option until kids under the age of 12 can get those vaccines. I encourage families and schools. Also, schools have lots of funds available to purchase as many of these masks as they can to better protect than cloth masks. Now, the bottom line is this. This, again, I will repeat, is a pandemic of the unvaccinated. We need you to get vaccinated. Vaccinations save lives. Vaccinations allow us to continue to get back to normal. Vaccinations help the economy. Vaccinations help all of those things that we wanted and that we missed to get back. I would encourage everyone who is concerned to visit coronavirus.utah.gov to find out all the facts about this vaccine. Talk to your doctor if you still have questions. There's so much misinformation out there, and there's so much data that proves that the vaccine is safe and effective. It's truly the miracle that we've been praying for, so please don't put it off any longer. I'd also encourage family doctors to reach out to patients by text or email and let them know the facts about the vaccine. The local health departments, the state health department, we're doing all we can to keep you safe, but all we can do is make recommendations. Now is the responsibility is in your hands to get vaccinated. Together we can save lives and help our healthcare workers. I'll just end with two quick things. I know the CDC has recommended masks for indoor gatherings, and I appreciate people. Masks are required here at St. Mark's inside, and you're wearing those masks. We will likely have more businesses that require masks, and that is absolutely their right to do so. And everyone should abide by those requests and wear masks where required to do so. The frustrating thing is that they're doing this not because those of us that are vaccinated need to wear masks to protect ourselves. They're doing this because our hospitals are filling up, and we're going to hear more about that. We had throughout this, we had all sacrificed for the common good. We all wear masks to keep everyone safe, even if we're not that at risk. That's not what this is about now. Probably nobody in this audience right now needs to wear a mask to keep us all safe. The reason you're asked to wear masks is that there is a small amount of breakthrough cases, still very, very small amount of breakthrough cases. We know that that could then be passed on to someone who is unvaccinated. So we're asking, the CDC is asking all of you who are vaccinated to take one for the team once again to protect people who are not vaccinated, but who have the opportunity to do so. Also, I'm guessing that the Venn diagram of people who are vaccinated or unvaccinated and willing to wear a mask is very, very slim, if at all. And so I'm grateful that there are people who are willing to sacrifice and wear masks again to protect the unvaccinated. I gotta be honest with you, I don't know if I'm one of those people. I'm really tired, I'm really done with it. And I'm not real excited to have to sacrifice to protect someone who doesn't seem to care. But I'm glad that there are some people that are willing to do that. Thank you. Now our hospitals, we do not have as many people hospitalized now as we did at the high point or the low point of our last surge prior to vaccines, okay? We don't have as many. We were close to 600 people hospitalized then. We're in the mid 300s right now. But there is a major difference. And that major difference is that we lost a tremendous amount of healthcare workers in our state. Many of them retired. Many of them found new jobs. This pandemic literally wore them out. So many of them have left, which means that even though we have beds, we don't have personnel to take care of those beds. As such, we are reaching our capacity. Our hospitalization capacity is full. And this is when, again, while it's almost all unvaccinated people that are here in the hospitals, now it's starting to impact everyone because we're now starting to have to delay surgeries, to keep hospital space available for people who aren't willing to get vaccinated. That's why we're doing this today. That's why we're here. Greg Bell is here to talk more about this. We'll turn some time over to him. Following Greg, again, who is the Utah Hospital Association director, we will have Lieutenant Governor Henderson. She will talk about our vaccine numbers, and then we'll have Dr. Hoffman talk about the Delta variant and some of those breakthrough cases that I mentioned earlier, and then we'll have some time for questions. So with that, former Lieutenant Governor Bell, the microphone is yours.
Thank you, Governor. The governor gave me this mask and now he's telling me it's not working. We want to thank St. Mark's Hospital for hosting us today. Thanks to Governor Cox and Lieutenant Governor Henderson for their tireless and intelligent leadership. I'm just amazed at where they go, how they do it, and they constantly do it. And we're very, very grateful for their sacrifice. You might think of hospital beds, especially intensive care unit beds, as water in a drought. They're there for everyone in the state of Utah and even traditionally neighboring states for whom we are a regional hospital center. But they are limited, and like we've seen with water in this drought, they only go so far. They're a common resource, but they can be depleted. And that's my assignment here today. In the last 17 months, hospitals in Utah have treated 17,000, nearly 17,000 people for COVID inside hospital walls. That would fill up the normal basketball stadium. Think about that. That's a lot of people. Well, just when we thought we were free of this, a new variant, a mutation, grabs us by the legs and apparently wants to shake us hard. This time around, it's going to be better. But this time around, it's going to be worse. It'll be better because so many of those of us 65 years and older and otherwise vulnerable have been vaccinated. Thus, the reach of the disease for those folks will be much, much, much less, where many of the fatalities occurred. So to that degree, we expect it to be significantly better. It will be worse because of this chart that the governor had alluded to its numbers. So here we have, since the beginning of the pandemic numbers, this is the number of ICU beds or total capacity for our 16 referral centers where difficult COVID cases are taken. This is the 100% line. You see it varies somewhat based on temporary ICU beds being stood up. This is the 85% line because an ICU traditionally is full at full capacity at 85% because of staffing, because of churn, because of admissions and discharges. 85% has maxed out traditionally. So this is the holiday peak. So last year in Christmas and New Year's, we were at the top of the dam, if you will. The spillway was right there. Miraculously, I think providentially, we escaped overspilling the dam. We didn't have any beds left. We were shifting from hospital to hospital, system to system, to load level. Notice the COVID beginning at the 1st of May, COVID represented 12% of hospital ICU occupancy. We trended up to the first scary surge in mid-July. Then we trended down for a little honeymoon period. Then school began. And then we had a steady march. And remember on November 1 or approximately then when Governor Herbert rang all your phones on that Sunday night and gave a dramatic address saying, we're on a collision course. And then we had a social pause and so on and so forth. Nonetheless, at Thanksgiving and then at Christmas and at New Year's, we peaked out at about 43, 44% of our ICU capacity in these referral center hospitals. We ended down dramatically, and here we just worked our way along through April, May, June, and some of July. And in the latter part of July, the Delta variant started to take hold, and we went from 10% of our ICU capacity being COVID patients to now, as of Sunday, 30% of ICUs are now full of COVID patients. Now notice the general occupancy hovers around 70% and goes up now to 86, trending to 90. Well, why is this so high when COVID is so low? Because in summer, people have rock climbing accidents and car accidents and have trauma incident to recreational activities, boating, whatever. We have our normal load of end-stage renal failure, heart attacks, strokes, the medical calamities that unfortunately befall people in life. And so our summer season is very, very busy. We're stacked. And now you add another 30 going perhaps to 35, 40%. If we hit the other peak, it will be almost half of our ICU beds. We can't handle it. So this common resource of these wonderful hospitals with tremendous technology and incredible caregivers are starting to max out. The governor alluded to the question, well, why? Why can't we just tool up like we did 7 months ago? Well, intensive care is aptly named. It's an intense environment. Caregivers work 12-hour shifts through the night, through the day, and often in crises, they stay an hour, 2, 3, 4 hours. Then they're asked to take extra shifts to fill in for those who are ill or for vacancies in the workforce. This is a difficult profession, and nobody can make them do it. They do it not for the pay. They do it because they're devoted. Most of them have a mission. They're altruistic professionals. But many have left the profession. They're done. They're burned out. They've gone home. They've gone to other jobs. They're highly skilled. They can go elsewhere in the medical profession where they don't have this constant pressure. And some of them are just burned out. Also, like every other business, this is a tight labor market. Everybody is competing for skilled workforce. We're no different. Intermountain Healthcare is seeking 1,300 nurses and skilled medical professionals. University of Utah Health, this is from WANADS, seeks 700 nurses and skilled medical professionals. I'm sure HCA and Steward and others are in the same fix. We're seeing important surgeries delayed. So we have had to stop, for the most part, taking referrals from out of state with smaller hospitals whom we've cultivated relationships over the years, but we're preserving whatever capacity we have for Utahns. Now, we can't expect help from other places because every state almost is having a COVID spike to manage themselves. They're not going to be in a position to export help, nurses, techs, docs, for our sake. Finally, with the Delta variant being so transmissible and so serious, it's just going to be harder to fight this disease. And we're seeing younger, healthier people die. Let me just say one final grandfatherly word to those who are not vaccinated. Your decision to be vaccinated or not may well be one of the most important decisions you ever make, personally and for those you care for. Get real facts from credible sources. The wrong decision could kill you, and you won't know till it's too late. Thank you.
Thank you, Greg. It's always good to share the stage with two former lieutenant governors. This week marks their anniversary since myself and 4 of my family members came down with COVID. It was just a couple of weeks before our daughter's wedding when my husband started to feel ill. And by the time we realized what his symptoms meant, it was too late for the rest of us in the household. Thankfully, we didn't spread it beyond our walls, the walls of our house, but it was I've been feeling a little bit of unease and nervousness and distress over the past week as we've seen the numbers increase. Remembering a year ago, and I can't believe it was only a year ago, the thing about COVID is you just never know. You never know who it's going to affect and how. You never know if you're going to be one of the lucky ones, and there are a lot of lucky ones, or if you're going to be one of the ones who's unlucky. I do consider myself one of the lucky ones, even though I was very sick. I had COVID pneumonia in both lungs. I was on supplemental oxygen for several months. And I still, although I feel sometimes like, yes, I'm fully recovered, I still suffer from the effects. I have a really hard time going up hills. I still struggle with breathlessness after a year. And so this is really poignant for me. And I just don't understand why we're still having this conversation. Last year, we pleaded. We were so excited. We were so hopeful for a vaccine that was supposed to be the end of, it was supposed to be the tool that fixed all of this for all of us. And somehow that has been politicized. And somehow We've got a large portion of the population who has chosen not to be vaccinated for whatever reason. And my remarks today are not going to be geared toward those individuals. Most of those individuals will never change their minds, no matter what we say. My remarks today are going to be toward two other groups of people. But first, I want to give you an update on vaccine numbers. We're reporting that 68.1% of Utahns 18 and older have received at least one dose as of yesterday. And we've actually, last week, we reached that 3 million mark. I remember earlier this year when we were so excited to reach the 1 million mark. We've reached the 3 million doses administered in Utah mark. This is really an incredible achievement. And I want to thank the providers, the pharmacies, the local health departments who have worked incredibly hard to hit this limit. Earlier this year, it was all hands on deck. It was such a monumental lift and a monumental effort that so many people worked tirelessly to achieve. So grateful for that. So many lives have been saved because of it. But really, our work is not done, and we've got to pick up the pace. And we're going to keep working with incredible urgency. We're going to keep looking for any options that will make vaccinations physically, emotionally, and mentally, logistically easier for everybody. But here are the two groups of people that I want to address today. First is business owners. Now, Governor Cox has mentioned, I've mentioned, we've mentioned many times that we're not requiring vaccines. But we also are big believers in the free market. And we're also big believers in personal responsibility and consequences of actions. And so my message today for business owners is Governor Cox and I support you if you decide to require your employees to be vaccinated. We support you in that. My next message is for physicians. Studies have shown that physicians are the most likely people to be able to change someone's mind, to be able to get those who haven't been vaccinated to become vaccinated. Us standing up here talking to the unvaccinated is not going to move the needle much. But the physicians, you play a critical role in this, and you have a responsibility as the leader in the healthcare industry, as someone that your patients look up to. Please reach out proactively to all of your patients who are not vaccinated and make sure they get vaccinated. We know that there are a lot of physicians who do not have vaccines in their clinics, and our health department, our local health departments, they're going to make this easier for you and are willing to work with you and pleading to work with you to make sure that you have supply needed. But barring that, you can still help your patients be informed about the dire consequences, not only for them personally, but for those that they might love and respect. The dire consequences if they remain unvaccinated. So please, employers, do everything you can to encourage your employees to get vaccinated. And this last winter, we experienced a real heavy blow to our economy, to our health, to our way of life. We do not want to go back to those days. Those are the bad old days. We don't want to go back there. And everybody who is unvaccinated is part of the problem, the reason we're here today. But businesses, physicians, you can be part of the solution, and we're begging you to please do so. And now, Dr. Hoffman.
Thank you, Lieutenant Governor Henderson, and thanks again to St. Mark's for hosting us today. I'll start off with a few minutes on some data points. Cases continue to increase in every state, including Utah, and they're increasing quickly. Currently, Utah has the 9th highest case incidence rate in the nation at 136 per 100,000 people per week. Since July 1st, COVID cases have increased 5%. COVID hospitalizations have increased 7%. Utah has the 12th highest hospitalization rate in the United States and the 11th highest state percent positivity rate in the United States. We rank number 33 in the nation for the number of people fully vaccinated. Our highest positive test rates are among the 25 to 44-year-olds and the 45 to 64-year-olds, followed by 15 to 24-year-olds. This indicates that most cases are in people who are eligible to be vaccinated. We've received a lot of questions about the Delta variant, vaccine breakthrough cases, natural infection and how it compares to immunity from vaccination, and of course, how all of these things will impact the return to school in the coming weeks. Let's start with the Delta variant. The Delta variant was first identified in Utah in April of this year. In July, it represents about 80% of the variants we're seeing. The Delta variant is the most transmissible COVID-19 variant yet. It could be as contagious as the chickenpox and spread more easily than the common cold, according to recent reports from the CDC. No vaccine is going to be 100% protective from infection. Variants arise when the spread of a virus is uncontrolled because of inadequate community immunity from both the disease or vaccination. Rarely, vaccinated individuals can become infected with Delta, and when they do, they have viral loads that are similar to those who are unvaccinated and infected. That means they can transmit the virus as easily as those who are unvaccinated. COVID-19 vaccines still offer the strongest protection against the Delta variant, but its high transmissibility means it's going to continue to wreak havoc, raising hospitalization and death rates, especially among unvaccinated people. Let's spend a few moments on vaccine breakthrough cases. The governor informed us how much more likely it truly is for those who remain unvaccinated to get COVID-19, become hospitalized, and die. Breakthrough cases represent a very small percentage of our cases in Utah, and most breakthrough infections are mild. Virtually all hospitalizations and death continue among the unvaccinated. We're continuing to monitor available data, but we know vaccinated people represent a very small proportion of those transmitting the virus to others. In addition to getting vaccinated, choosing to wear a mask, especially in indoor settings, is another important way to prevent the spread of COVID-19 to others. Natural infection versus immunity. Information on immunity levels provided by natural infection vaccination continue to evolve. We know those who've had COVID-19 infection can have a strong antibody response, but vaccination has been shown to produce stronger and more consistent antibody responses than natural infection alone. Immunity from vaccination is also safer than natural immunity. We can't predict who's going to get a severe case of COVID-19 or die. The good news is it's never too late to get vaccinated, even if you've already had COVID-19. To close, I'd really like to spend a few minutes on children and COVID-19. I'm a pediatrician by training. While most children who get COVID-19 will have fewer symptoms than adults, COVID-19 can be a serious disease for some children. 57% of Utahns are fully vaccinated, but 0% of children 0 to 11 years have been. With the return to school around the corner, it's more important than ever to take precautions to protect those who are too young to be vaccinated. That's why yesterday, after extensive discussions with input from many stakeholders, the Department of Health released a new set of guidelines for local health departments, schools, and parents to take to minimize the disruptions that we all experienced last year with the school year, especially our children. Key takeaways from these recommendations include all the preventive measures that we took last year work. You can choose to do them. You can also choose to get vaccinated and should if you're able to. Please wear masks in schools, especially, and this is an especially important conversation for families if they have a school-age child who's not eligible to be vaccinated yet. As a pediatrician and a parent, I urge you to carefully consider the choice to get you and your children vaccinated. The most important thing you can do to protect yourself today and to protect your family and loved ones is to get vaccinated. Thank you.
Thank you, Dr. Hoffman. And with that, we've got about 10 minutes for questions. Please, ma'am. Well, again, we've talked about the changes to the law and what is allowed and what is not allowed. We don't believe that any additional restrictions will, one, can be implemented, and two, would make a significant difference. Again, as I mentioned that kind of Venn diagram, the people that are willing to abide by those restrictions are already doing the things that are necessary to prevent the spread of the virus. And so I just want to say, and I want to give some good news. I didn't share the numbers with you before, but last week we had 27,000 people get their first dose. That's incredible. That's a good number. Again, I'd rather it be double that, but to be up to 27,000, that's a 5,000 vaccine increase over just the week before, which was also an increase from the week before that. So the message is getting out. We are seeing changes that are being made. As Dr. Hoffman mentioned, we encourage especially those who are vulnerable, most vulnerable, to mask up. If you're not vaccinated, you absolutely should be wearing a mask. And so those are the changes that are allowed to be implemented. And one of the things we're doing is this, and that is getting. It's interesting, Ben. If you go back and look at behavior during the first year of the virus, it tracks very closely whether there were restrictions in place or not in different states. If you look at the Google mobility data, for example, people make decisions based on what's happening out there, and that's the unfortunate part of this. As the Lieutenant Governor mentioned, whether or not California may shut down their economy and Utah doesn't. There will be an economic impact. People will just choose to act differently because there is so much spread out there. And that's where, I mean, it's easy to say that this pandemic of the unvaccinated is just impacting the unvaccinated, but it's not true. It's impacting all of us. It's impacting us. It will impact us economically. It will impact our ability to go to the hospital. If mom or dad has a knee surgery scheduled, they're not going to be able to get that in some of our hospitals right now because of that chart that Greg Bell shared with us, and so people will respond depending on what's happening out there, and that's exactly why we wanted to have this press conference this morning. Please.
So I think we're hearing a lot of exasperation, which I think we're all feeling. But what is the strategy going forward? Because, like you said, it's difficult if people aren't going to be willing to follow certain restrictions that's sort of off the table legally. You mentioned having doctors reach out to people.
Yeah.
Could you talk about what is the strategy going forward, I guess, to get a handle on it?
Sure, and there is some exasperation. I think you heard that. I'll try to put the positive spin on this again. The fact that we did see an increase in vaccinations. The strategy. So let me add one piece to this. We also have a hotspot strategy. We didn't talk about that today. It's something we've been doing. We're expanding that, and that is that the health department is determining where the biggest outbreaks are happening, and then we're going in with our mobile clinics. We're reaching out to local leaders. We're reaching out to local physicians in the area, local churches in the area, getting everybody involved to get more people out and get them vaccinated. And what we've seen when we do go into these neighborhoods, we have seen a significant uptick because we can go out and say, hey, you are in an area right now that is experiencing a surge. And let me backtrack a little bit. We've talked about people who are willing to get vaccinated and people who want nothing to do with the vaccine. There's still a fairly significantly large group of people who are kind of on the fence. And as cases were coming down, they thought, well, if I can not get vaccinated and we reach herd immunity, great. That's kind of their sweet spot. And they thought they were there as cases were plummeting and hospitalizations were going down. And now they realize that they're not there, and so they're at risk. And so those are the people that we're really trying to reach, and where we are having some success. And so that seeing that 5,000 increase just over last week, 27,000 people, those are pretty good numbers. Again, we'd like to see them 30, 40,000, upwards of 50,000 back where we were when in April and May, but we'll take it. We'll take that increase, and that's really our strategy. Now, the other thing I want to say is this. there's so much we don't know. I wish there was more humility in all of this. I wish everyone seems so sure of themselves. And if there's one thing we should have learned over the past 18 months is that nobody knows anything. And we've all been wrong about this at one point or another. And what we have seen with the Delta variant in the UK, we saw it in India, in Israel, is that as quickly as it goes up, it turns around and starts going back down. And so no one knows exactly how far into this Delta variant wave that we are right now. The good news, I will add to the data that was shared on where Utah fits with this Delta variant wave. If there's any good news, it's that as a percent increase over the last 14 days, Utah's at the bottom. So we've seen about a 40% increase over the last 2 weeks, where other states are seeing a 300 or 400% increase. So we're hopeful that that means that we're nearing a crest and coming back the other way. But it could be that it's just a pause and we're going to shoot right back up again. We don't know because we know so little about the coronavirus. We know even less about the Delta variant and when it actually turns around. What was it in the UK? I mean, in the UK, there was a guy who was saying they were going to get to 200,000 cases a day, and 2 weeks later he was saying this will be gone by September. An expert, because that's just what happened. It went up and it went down. So I don't know exactly, and no one can tell me when this is going to turn around. But what we do know is that vaccines matter. The UK has a higher vaccination rate than Utah, so that's not good. We need that vaccination rate to go up. Sure. Yeah, we don't have a lot of sticks. So, look, I don't know, Brian. I appreciate it's great to have the legislature want to get involved. We welcome that. That's certainly their authority. It's a little harder for a body of that size to react in the moment, but they will, and they've said they will. We've had conversations about where we are right now. They feel that the authority that was given to local governments is enough right now, but we continue to have these conversations, and these hospitalization numbers are really concerning. But I support the legislature using their authority as they see fit. Let's go back here. Yes, Dr. Hoffman. We support encouraging people to wear masks in the school. That's different than a mandate, right? And so that recommendation goes out to the schools, and we support that. Families and kids are going to have to make those decisions. And I want to say this again, because this is really important. Look, guys, especially in our younger ages, this is not a transaction without consequences. Every single kindergarten and first grade teacher I talk to, even those that believe in masks and those that believe in vaccinations and those that believed in all of the measures and even wanted some stronger measures, will tell you that there is an impact on the development of young children by wearing masks in schools. That their ability to read, their verbal and cognitive skills were slowed down by wearing those masks. Even the CDC guidelines last year said that there should be exceptions made in those very early grades for mask wearing when it comes to cognitive verbalization and verbal development. So these are really important discussions. Again, so families and parents are going to have to weigh lots of different decisions. One, is there somebody in our family that is high risk? If that's the case, then yes, even if they're vaccinated, you should wear a mask. Is there, how is our child developing? Do they have some special needs? Is it really difficult for them to make those connections and to be able to read and verbalize? And we had 23,000 cases, 111 outbreaks, or 111 hospitalizations, and one death. Does that weigh does that outweigh the need for a mask? Those are decisions that are going to have to be made at every level. But the recommendation is, if you're not vaccinated, you should wear a mask. And so we support that recommendation, but those are decisions that are going to have to be made elsewhere. And I'm going to have Dr. Hoffman come and answer that question. But somebody over here was really trying hard, and I'm gonna go here, and I'm gonna get in trouble. But yeah, it's a great question. I think we could definitely make those changes. Thank you for the suggestion. That's just kind of what we were using throughout the pandemic, not knowing what vaccines would do. But now that we have vaccines and those numbers are different, I think it absolutely makes sense to differentiate between those age groups, and we'll work with our data teams on getting that happen. Okay, the last question, Dr. Hoppins, who had the last question? Okay, yeah.
Modeling is a challenging sport. We predicted a few weeks ago that we were going to hit between 1,000 and 1,200 cases per day, and we got very close to that. And in fact, we got there. I'm not certain the peak of this. As the governor mentioned, it does appear that we're having a downtrend in terms of the pace of the continued increase. We were ahead of some other states, in part we were able to detect the Delta variant more quickly because we have access to whole genome sequencing in our state. So we don't know how far ahead we are, but we know that the Delta variant came from the West and moved this way. And so we're ahead of other parts of the country. And so we may have hit our peak and we may be going down. I can speak specifically to some modeling in the K through 12 age group. As of last week, we were having about 160 cases per day in children in the ages from from 5 to 18. Now, that represented about 160% increase from where we were at this time last year. So it's a really critical moment going into school. We have more cases in children right now than we did last year at this time. We modeled that could either remain at that level versus increase up to 4 times by October. And so just in that age group alone, we are still looking to see potentially some increases. But modeling is a difficult one. There's a lot of range there. So thanks.